plus. Nearly half of all Americans are living with obesity, which is second only to smoking as the leading cause of preventable death in our country.
While there's no magic bullet to reverse the chronic disease's growing trend, experts and patients say they found something that's working. Medications targeting weight loss and diabetes like Wegovy, Zepbound, and Ozempic are part of a relatively new class of drugs that work by suppressing appetite and food intake. They've been hailed as not only life-changing, but life-saving, leading to a surge in popularity in recent years.
But not everyone can get their hands on them. Many insurance plans don't cover the medications if prescribed solely for weight management, and the out-of-pocket cost can be crippling.
Reporter Heather Graff shows us just how devastating that reality is for some patients and what's being done about it.
For a long time, I was on a upward scale of just gaining weight.
For North Carolina mom Kiana Price, trying to stay healthy has been a lifelong battle.
And I remember seeing a picture of myself that someone else had took, and I was like, oh my God, I can't believe I had gotten that big.
The reality of what she saw terrified her, not because of how she looked, but how she felt. Kiana is pre-diabetic with a family history of diabetes.
It's a trickle-down effect, and I'm really trying to stop, and not get to that place.
Over the years, she tried managing her weight with diet and exercise, but nothing was working. Not until 2023, that is, when she started taking a relatively new weight loss drug called Wegovy.
I was losing weight, my A1C had came down, I felt a lot better, I was doing a lot better.
Kiana lost about 60 pounds in a year.
This was the most consistent weight loss I had ever seen for the longest period of time.
Wegovy is part of a class of medications called GLP-1 agonists that work by reducing blood sugar levels.
And they also interact with appetite hormones to lower and suppress appetite.
Clinical trials have shown patients can lose more than 10% of their body weight. And according to University of Pennsylvania cardiologist Dr. Lauren Eberly, the results are compounded over time.
These medicines really have also been shown to lower your risk of a heart attack, risk of a stroke, and improve quality of life in certain types of heart failure. So there's really tremendous benefit.
While GLP-1 medications are typically covered for type 2 diabetes patients, insurance coverage can be harder to come by for those strictly overweight and treating obesity. In fact, according to a recent JP Morgan survey, less than half of employers offer coverage for weight loss management alone, and current laws prohibit Medicare from doing so.
How frustrating is all of this?
It's very frustrating.
In April 2024, Kiana's health plan stopped covering GLP-1 medications that had been prescribed for weight loss, citing cost. She had been paying $25 a month for Wegovy and was now looking at more than $1,000 out of pocket.
It's ultimately me deciding, am I going to have a place to stay for me and my kids, or am I going to pay for this medication? And I just knew that wasn't an option.
Cost is a common threat among GLP-1 medications in the United States.
People are going into debt. People are putting this stuff on credit cards because they're so desperate.
Weight loss specialist Dr. Janice Laster has spent years advocating for more widespread availability.
What are the cost comparisons covered from insurance versus not covered?
Oh, it's huge. If it's not covered, they can be upwards of $2,000 a month. If it is covered, it's from $0 to $25 a month.
At the federal level, efforts are underway to help remove the price barrier. A bipartisan bill was introduced on Capitol Hill in 2023 that would allow Medicare to cover FDA-approved obesity medications. It's called the Treat and Reduce Obesity Act, and Laster says it would be an important step because Medicare often influences private insurance as well.
It feels very wrong that patients that really need it don't have access.
A similar measure was proposed in late 2024 by the then Biden administration.
What would you say to lawmakers if you had them sitting right here?
I need for you guys to get to work. Some people are fighting for their lives, and this is helping them in that fight.
Senator Bernie Sanders has been vocal about the need to get weight loss drug pricing under control.
If not made affordable, Americans throughout this country will needlessly die and suffer.
In September 2024, he grilled the CEO of Wegovy maker Novo Nordisk at a Senate hearing.
From a moral perspective, does it bother you knowing that keeping the price of Ozempic and Wegovy so high in the United States could lead to the preventable deaths of tens of thousands of Americans?
So, Senator, we are very committed to make sure that Americans have access at affordable price point for our medicines.
Novo Nordisk representatives declined to speak on camera, but provided a statement saying in part, "We look forward to continuing to work with policymakers and other stakeholders toward meaningful solutions for the people who rely on our medicines." Meanwhile, a recent study led by researchers at Yale and the University of Florida says expanding access in the country could prevent more than 40,000 deaths a year.
These medicines are just tremendously effective, much more so than, all of our recommendations that we can make, for exercise and diet changes.
What do I have in my pantry?
But for many, consistency is key, because research shows that weight regain is common when patients stop taking GLP-1 medications, particularly when it's abrupt.
Since I've been off the medication, my weight has gone back up. I feel like I'm reverting back to the beginning of this whole journey, and I don't want to go back there.
Kiana says she's taking her weight loss journey one day at a time.
Trying to stay in the gym, stay motivated to do it on my own, but it's been tough.
That's why she seeks out motivation any way she can.
Whatever the problem is, the answer is not in the fridge.
Because for this mother, failure isn't an option.
I want to be here to see them graduate from school. I want to be here when they start their families. And if I don't do something now to turn this around, it's not going to happen.
For those without insurance coverage, there are several ways you could save on weight loss drugs, including patient assistance programs, savings cards, and health savings accounts. Novo Nordisk's Wegovy savings card can take hundreds of dollars off the list price, and Eli Lilly offers a similar savings card for its weight loss medication Zepbound, which Maryland resident Jonathan Myers has been taking since early 2024. He's taken advantage of the discount and factors the cost into his monthly budget.
I prioritized it as an expense, a life expense, just like rent or mortgage or a car payment or grocery stores. So from my perspective, it's just as important as that. So I'm budgeting for it.
According to drug makers, common side effects of these weight loss medications include nausea and abdominal pain.
Meanwhile, a 2024 Senate report noted that while Wegovy, for example, costs more than $1,300 a month in America, it's just a fraction of that in other countries. Some call this a failure by Big Pharma and the country's healthcare system.
Zepbound maker Eli Lilly, which declined to speak on camera, says comparing U.S. list prices to other countries overlooks patient affordability programs and the substantial discounts and fees paid to PBMs by pharmaceutical companies, which should reduce costs for Americans but can sometimes drive prices higher.